I'm sure you've all heard the great news that the first coronavirus vaccine injection has been carried out today. This is for the Pfizer-BioNTech, and this will be continued to be made available starting from this week. After so long, I'm sure you'll agree with me that it's great to have some light at the end of the tunnel, but I know there are concerns that our residents have and lots of questions in general about the vaccines. This particular one will be mainly rolled out to our hard-working frontline hospital staff who have been helping to save so many lives throughout the pandemic. It's only right that we protect those who are putting their lives on the line every day to help save others. A small number of care home residents and staff near the hospitals will be able to have this vaccine also. We are hopeful that the AstraZeneca, the one from Oxford University, will be approved soon, and that will allow for a much wider rollout as it can be transported much more easily and does not need to be stored at -70 degrees. This means that the wider public may be able to begin to be vaccinated early in the new year. The rollout will initially be based on those who are most at risk of developing severe complications from coronavirus, then going on from people aged over 80 years, frontline health and social care workers, and then those aged over 75, 70, 65, etc. Individuals aged 16 to 64 with underlying health conditions will be offered the vaccination after 65 years of age. An older group have already had theirs. At this time, pregnant women and women planning a pregnancy are not recommended to have the vaccines. This is to be extra careful until more is known about them. The NHS will contact you when it's your turn to come forward, and there is no need to contact your GP at this stage. They're already receiving a large number of phone calls, and they will come to you when it is your turn. The aim is that eventually all adults will be offered a vaccine. Those at much lower risk, so these are healthy people aged under 50, are unlikely to be able to get a vaccination until the spring, but the NHS still hopes that the vast majority of northwest London, which is where we are, technically, will be vaccinated by the end of April 2021. We know that what ingredients are in each vaccine is something people want to know as soon as this is made public, and we will make sure to share that information with you. Remember, there have been thousands of candidates who have been tested to make sure that these vaccines are safe, including some of our own councillors who have put their name forward to be part of the trials. At this time, I just want to thank you all for the commitment that you've all shown in following the government rules, sticking to all the various different rules and regulations that we've had to do over the last few months, and I'm sure that we all look forward to be able to look back at this time and make sure it's in the past once the vaccination has been rolled out and the risk to our population is diminished. So the last thing to say really is just to wish you all a very Merry Christmas and to hopefully see you all soon.